The Silent Threat, a story that could be yours. It's a quiet Monday morning. You're sipping your coffee, maybe getting the kids ready for school, or heading into your first meeting. Everything feels routine until something doesn't. You fumble your mug, your arm feels weak. You try to speak, but the words come out garbled. You shake your head, confused. Your heart races. This isn't just tiredness. It's not stress. It's something more serious. That's exactly what happened to Mark, a 42-year-old father of two and marathon runner. He was healthy, driven, and always on the move. But in the days leading up to his stroke, he felt off, numbness in his fingers, a strange fogginess, a headache that didn't feel like his usual migraines. He ignored them all. By the time his wife found him collapsed in the kitchen, he couldn't speak, couldn't move, could barely breathe. Mark survived, but it took months of rehab to regain his speech and coordination, and he's one of the lucky ones. Here's the harsh truth. Studies show that nearly 90% of stroke victims ignore the early signs. They think it's fatigue, dehydration, or just a bad day. But strokes don't always arrive like thunderclaps. Sometimes they whisper. This video is your guide to recognizing those whispers before they roar. You'll learn the 5 early warning signs of stroke most people dismiss, why time is the most important factor in survival, what BEFAST means and how to use it, how to respond in the critical first minutes, and simple steps you can take to reduce your risk starting today. This isn't just information, it's protection. For you, for your family, for the people you love. Because stroke doesn't just change lives, it can take them. Let's not wait until it's too late. What is a stroke and why it's so dangerous? A stroke is not just a medical event, it's a sudden, brutal interruption of life as we know it. A stroke happens when blood flow to the brain is blocked or a blood vessel in the brain bursts. The brain is a hungry organ. It needs a constant supply of oxygen and nutrients. When that supply is cut off, brain cells begin to die within minutes. There are 3 main types of strokes. 1. Ischemic stroke. About 87% of all cases, caused by a blockage in a blood vessel supplying the brain, often due to a clot. 2. Hemorrhagic stroke. Caused by a blood vessel rupturing and bleeding into or around the brain. 3. Transient ischemic attack, TIA. Often called a mini stroke, it's a temporary blockage that resolves quickly but serves as a major warning sign. Each type is dangerous. Each second lost increases damage. Here's what stroke can affect: your ability to walk or move, your ability to speak or understand others, your memory and decision-making, your emotional control, even your ability to swallow, breathe, or stay conscious. The statistics are staggering. Every 40 seconds, someone in the world has a stroke. It's the hot second leading cause of death globally. It's the leading cause of adult disability. But here's the good news. Up to 80% of strokes are preventable. If treated quickly, some strokes can be reversed or significantly reduced in impact. It all starts with recognizing the signs. Because stroke is a thief of time, and time lost is brain lost. Now let's dive into the first early sign most people overlook. Sign number 1, sudden numbness or weakness on one side. Imagine reaching for your phone and suddenly dropping it. Not because it slipped, but because your fingers feel lifeless, or trying to stand and feeling your leg give out. Not from tiredness, but because it's simply not responding. This kind of sudden, unexplained weakness or numbness, especially when it happens on one side of the body, is a classic urgent sign of stroke. Your brain controls your body in a beautifully complex way. The left side of your brain controls the right side of your body, and vice versa. So when a stroke affects one hemisphere of the brain, it shows up in the opposite side of your body. Mark, the man we mentioned earlier, noticed something odd the day before his stroke. His left hand tingled almost like it had fallen asleep, but he shrugged it off. Hours later, he couldn't move it at all. Here's what to watch for: numbness or weakness in the face, especially one side. Inability to lift one arm or leg. Trouble with grip, dropping things unexpectedly. You can try a quick test. Ask the person to raise both arms in front of them. If one arm drifts downward or they can't lift it, take action. Ask them to smile. If one side of the face doesn't move or the smile looks uneven, that's a red flag. And here's something critical. If the symptoms go away quickly, don't relax. That could mean a transient ischemic attack, TIA, a mini stroke that often precedes a major stroke. A TIA is your warning shot, your chance to act before permanent damage occurs. According to the American Stroke Association, up to 1 in 5 people who have a TIA will have a full stroke within 90 days, many within the first 48 hours. Don't wait. Don't second guess. Even if it feels minor, call emergency services immediately. The sooner help arrives, the greater the chance of full recovery. Sign number 2. Sudden confusion or trouble. Understanding you're in a conversation and suddenly the words don't make sense. Not the ones you're hearing and not the ones you're trying to say. Your brain feels foggy, like it's buffering. You can see the person speaking, but their words sound like another language. You try to respond, but what comes out is gibberish. This is not just zoning out. It's not low blood sugar or distraction. It could be a stroke, and it's one of the most commonly ignored symptoms. Stroke can affect the Sarx language center of your brain, particularly in the left hemisphere. That area controls both speech production and comprehension. When blood flow is interrupted, you might experience trouble understanding what people say, difficulty forming coherent sentences, using the wrong words without realizing it, an inability to read or write clearly. Real story. Ellen, 55, was giving a presentation when her mind suddenly went blank. She could see her slides, but the words disappeared from her memory. She started speaking in circles, repeating phrases that didn't connect. Her colleagues thought she was just nervous, but she was having a stroke. The frightening part? These language issues often don't feel scary to the person experiencing them. They might laugh it off or feel embarrassed, but inside they know something is off. That's why it's crucial for bystanders to notice. If someone suddenly starts talking strangely, misusing words, or seems confused out of nowhere, act fast. Buddy. Use BEFAST. B for balance, E for eyes, F for face drooping, A for arm weakness, S for speech difficulty, T for time to call emergency services. Even if the person insists they're okay, call. Don't wait. Don't hope it passes. Your call might be what saves their ability to communicate or their life. Sign number 3, slurred speech or difficulty speaking. Imagine being fully conscious, knowing exactly what you want to say, but when you open your mouth, your speech comes out slurred, slow, or completely jumbled. That's what many stroke survivors describe. Slurred or strange speech is often the most obvious sign of a stroke. But because it can come on suddenly, and sometimes briefly, it's often dismissed as fatigue or mumbling. Here's how it typically presents. The person sounds like they're drunk, even if they haven't had alcohol. Words are slurred, slow, or distorted. They struggle to find the right word or use the wrong ones entirely. Sentences don't make sense. This isn't just a communication issue, it's a neurological emergency. Speech problems usually result from damage in the Broca's area, or Wernicke's area, regions in the brain that process language and articulation. If those areas are deprived of oxygen, even for a short time, the effects can be devastating. Try this test. Ask the person to say a simple sentence like, "The sky is blue." If they slur it, get stuck, or can't form it at all, call emergency services immediately. Time is everything. Every minute without treatment kills more 1.9 million neurons. Think of your brain as a high-speed network. When a stroke strikes, it's like a power outage. Connections drop, data is lost. Speech is often the first thing to go, and one of the hardest to recover. Don't gamble with it. Don't brush it off. A few garbled words could be the sound of a brain in crisis. Sign number 4, vision problems in one or both eyes. You're reading a book and the words blur. You're driving and suddenly your vision goes double. You close one eye thinking it'll clear up, but it doesn't. These sudden changes in vision are not normal. They could be signs of a stroke, particularly one affecting the occipital lobe or brainstem. Stroke-related vision problems can include blurred vision, double vision, diplopia, sudden loss of vision in one eye, tunnel vision or blackouts in your visual field. Here's what many people don't realize. Your eyes might be fine, but your brain can't process what you're seeing. Your vision is controlled by complex neural networks. If a stroke cuts off blood flow to those areas, your sight is compromised. Even if your eyes are healthy, vision symptoms often come on fast. They may last a few minutes or persist longer. Some people even experience visual hallucinations or flashing lights. Real case. Alan, 63, thought he had something in his eye when half his vision suddenly disappeared. He cleaned his glasses, took a break, but the blackout remained. His wife noticed he was bumping into furniture and called 911. He had a stroke. The worst mistake? Waiting to see if it clears up. If your vision suddenly changes, without warning, without trauma, seek emergency care immediately. Even if it resolves quickly, it might be a TIA. Remember, strokes don't just steal movement or speech. They can steal how you see the world. Sign number 5, sudden severe headache. This isn't a normal headache. It's not from stress or dehydration. It's sudden, explosive, and overwhelming. Many stroke survivors describe it as the worst headache of my life. Like a bomb went off in my skull, a flash of pain, then everything went dark. This kind of headache, especially if it comes with vomiting, neck stiffness, or confusion, may signal a hemorrhagic stroke. A hemorrhagic stroke occurs when a blood vessel ruptures in the brain, spilling blood into surrounding tissue. This puts intense pressure on brain structures and can lead to immediate, irreversible damage. Signs include sudden, severe head pain, nausea or vomiting, seizures, loss of consciousness, sensitivity to light. It can happen to anyone at any time, even young people. Case in point, Jasmine, a 29-year-old fitness coach, collapsed at the gym. She'd had a headache that morning but brushed it off. During a routine workout, the pain exploded. She blacked out. Doctors discovered a ruptured aneurysm. She had minutes to live. Emergency surgery saved her, but recovery was long. If a headache feels off the charts, act. Especially if it's accompanied by vision loss, weakness, or slurred speech. You know your body. Trust your instincts. Fast and be fast, your stroke detection toolkit. In an emergency, memory fails. Panic sets in. That's why stroke experts created FAST, a simple tool anyone can use. F for face. Ask the person to smile. Does one side droop? A, arms. Ask them to raise both arms. Does one drift downward? Speech. Ask them to say a simple phrase. Is their speech slurred or strange? T, time. Time to call emergency services, even if the symptoms are subtle. But FAST doesn't catch everything. Some strokes affect balance or vision first. That's where Be Fast comes in. B, balance. Sudden loss of balance or coordination. E, eyes. Sudden blurry or double vision. Combine both tools and you have a powerful checklist that catches most types of strokes. Now, memory, make it part of your household. Teach your kids. Post it on the fridge. Because when seconds count, BEFAST helps you act without hesitation. Scenario, you're at a barbecue. Your uncle stumbles, slurs a joke, and laughs it off. But you notice his smile is crooked. You ask him to lift his arms, one wobbles. You know what to do. You be fast. You save a life. Time is brain. Why acting fast saves lives. Every minute a stroke goes untreated, the brain loses 1.9 million neurons. That's the equivalent of 14 years of aging in just 1 hour. It's not dramatic, it's science. The best stroke treatments, like antimimum, a clot-busting drug, only work within a narrow time window, usually within 3 to 4.5 hours of symptom onset. Other interventions like mechanical thrombectomy, removing the clot through a catheter, can extend to 6 to 24 hours, but they still rely on early detection and rapid response. The faster you act, the more brain you save, the more function you preserve, the better your chances of full recovery. Hesitation is the enemy. Don't Google symptoms. Don't sleep it off. Don't wait for it to pass. Get to a stroke-ready hospital as fast as possible. Remember, you can recover from being wrong, but you might not recover from waiting too long. What you can do: prevention and preparedness. Stroke prevention starts with one word: awareness. Here's how you can reduce your risk. Check your blood pressure regularly. Control diabetes and cholesterol. Stay active. Aim for 150 minutes of moderate activity per week. Eat brain-healthy foods. Leafy greens, berries, fish, whole grains. Limit alcohol and quit smoking. Reduce stress through mindfulness or hobbies. And just as importantly, be prepared. Know your family history. Keep a list of medications. Learn your local emergency numbers. Identify the nearest stroke-ready hospital. Talk to your doctor. Get screenings. Don't ignore symptoms. Prevention is power. Finally, a conclusion: knowledge is power. Let's recap the 5 warning signs of stroke. 1. Sudden numbness or weakness on one side. 2. Sudden confusion or trouble understanding. 3. Slurred or strange speech. 4. Sudden vision problems. 5. A severe sudden headache. Use BEFAS Teachorn to spot stroke quickly. Understand that a time lost is brain lost. Don't wait. Don't hesitate. Don't gamble with your life or someone else's. You now know the signs. You have the tools. Share them. Talk about them. Because awareness spreads faster than any emergency. And that awareness, it saves lives. Or segment 12, life after stroke, recovery, hope, and moving forward. Surviving a stroke is just the beginning. Recovery is a journey, physical, emotional, and psychological. Many survivors face weakness or paralysis, trouble speaking or swallowing, emotional swings or depression, cognitive difficulties. Rehabilitation can include physical therapy to regaining movement, occupational therapy, daily life skills, speech therapy, language and swallowing, counseling, mental health support. Support from family and community makes a huge difference. New technologies like brain stimulation devices, VR therapy, and recovery apps offer more tools than ever before. And most of all, hope is real. With time, care, and resilience, many stroke survivors go on to lead meaningful, joyful lives. You survived, now you rebuild, now you thrive. Let this video be your beginning, not just an ending. Thank you for watching. Be aware, be fast, be ready. Together we can outsmart stroke.